All right, so end of day 2 of the SOSORT conference here in Boston. It's still a little chilly in Boston, but it was a great conference, great presentations, met a lot of cool people, some people that I've known for a while but had never met, so that's kind of cool. So we do a little bit of a review of some of the big takeaways that I had from this conference. For those who don't know what SOSORT is, it's basically the international body of conservative scoliosis treatment, meets and goes over research, and it's pretty cool stuff. And today's focus in the beginning was on bracing, and then it moved to scoliosis specific exercise. And one of the big takeaways that I had from today was that it's not always about which method you use for bracing or for scoliosis specific exercise, which is kind of interesting because we focus so much on what method you're using, like the Schroth method or the C's approach or the Lion method, or even bracing, what type of brace. And a point was brought up that maybe we should stop focusing so much on the cook and focus on the ingredients. Meaning, maybe, there are a lot of methods for scoliosis treatment that are fantastic, but how do we get people to do them better, to do them more frequently and more consistently? If we can get them to do that, and how good the orthotist is and how good the therapist is, rather than worrying so much about which method you're using. I think it was a really good point. So if you're doing scoliosis treatment yourself, how confident is your therapist or your orthotist in doing those treatment techniques? And if they're competent in it and they're really good at it, make sure you're doing it as well. So make sure you're actually helping the cook do the job as best he can, or she. They also talked about compliance early on in treatment. So compliance with bracing specifically. The first month, if someone's compliant with bracing, then they're most likely going to be compliant or do bracing the prescribed amount of time at 6 months. And so I think that relates to PSSE or scoliosis specific exercise as well. If someone isn't doing their exercises initially, they're probably not going to do their exercises long term. So if you are doing scoliosis specific treatment, make sure that you're consistent with it and make sure you're compliant with what's prescribed. I think that's also a big takeaway for me. There was an interesting one that talked about physiotherapeutic scoliosis specific exercise, PSSE, and the effectiveness. There were a few research articles specifically out of China that they talked about the effectiveness of those and how those, it's being shown that those are effective. That's more and more research is coming out showing that. One looked at if having parents do scoliosis specific exercise with, that's really loud. If having parents do scoliosis specific exercises with their kids helps with compliance. And I thought that was an interesting one. Teaching the parents how to do the exercise, not just having the child do the exercise. We might start doing that in our clinic to try and get a little more buy-in from the parents, and then we can also get them to direct that at home in a better way. We talked a little bit about EMG stuff with paraspinal changes on one side versus the other, and then some etiology or kind of the cause of scoliosis, which still it brought up a lot of questions, but I don't know that we have a ton of answers on what causes it. So overall, a fantastic course today. Great research. It's actually really cool to see how much research is actually going on about scoliosis treatment, because the literature hasn't been crazy strong, but it's getting stronger and stronger as time goes on. So we'll that was fun. So yeah, we'll see what tomorrow brings, and we'll go over some research. It looks like it's going to be a good time. So greetings from Boston again, and we'll see you tomorrow.